Recording now. Awesome. So it's great to have you, Dr. Dempster. We always love having you on because you're so full of wisdom and you're so caring. We love
and down to earth as well.
Down to earth.
I like that.
Yeah, exactly. Just so relatable and lovely. So thank you for joining us yet again.
I always love being here with you guys. Thank you. And please let me know if the audio does fade in and out. I'll do my best from here too.
Yeah. Okay. I think we got some comments that it's better, that us being turned down helped. So that's good. Okay, let me pull up my page here. All right. Well, actually, we've got some questions coming in the box. Barbara, the truth about avocados, please. I've heard yes, great, and no. Let's spill the beans on avocados, please.
Sounds like somebody might be having some suspicions with avocados. Now, I mean, avocados themselves, I consider to be one of the superfoods, but there are many people that do not do well with avocados. And I'll say that just right off the bat, being one of my many patients I saw today has a very severe reaction to avocados due to a histamine intolerance. And avocados are on the histamine list. And that may be not a new concept for a lot of your listeners, but histamine-rich foods can create a lot of inflammation in the body. They can create a lot of different types of, basically almost like an allergy reaction, but it doesn't come across as a typical allergy. It can come across as brain fog and come across as energy fatigue, digestive issues, and some people chronic pain and all sorts of things. So I love avocados. They're filled with lots of great omegas. They're filled with lots of great protein and fats and even fiber. But if you don't, or if you're suspicious of these are not vegetables, by the way, they're fruit. And we do want to make sure that we're eating right for our body. And sometimes we have to listen to what our body says.
Oh, great answer. Thank you. And how would a follow-up question, because we have a question here from Kristen that was actually messaged in advance. She says that she's been dealing with histamine reaction, SIBO, and acid reflux. And so she's asking, can you explain the histamine/stomach acid connection, and does one typically cause the other? Can you have low stomach acid with histamine intolerance and acid reflux? So what's the connection there, if there is one?
There's a big connection to histamine in the gut. And I'll start with that because the stomach is part of the gut. And there's many pieces of the gut. It literally is from the mouth all the way down to the rectum. And another huge part that has to do with your intestines. So they're all connected, right? And so stomach acid is the start where things and foods are getting digested and broken down. And if we have weak stomach acid, we can start to deal with foods that are not fully digested and broken down. And then they get passed on into the intestinal tract, where if they're already behind, then the small intestine and the large intestine are really dealing with a particulate that isn't ready to be in there yet. And what that can do is that can create intestinal permeability, and that can exactly do what we're trying not to do, which is exacerbate inflammation. Now, histamine is largely produced in the bowel. A lot of histamine is actually produced there, and we want to make sure that we're paying attention to the whole connection, as I mentioned, but we don't want to just be suppressing, certain parts of that. We want to look at the whole system. Starts with chewing, starts with making sure that you have intentional good eating hygiene, not drinking when you eat, making sure that all those digestive juices are working properly so that we're not dealing with stomach acid issues or eating foods that are going to create either hyper or hypochlorhydria, which is an imbalance in your stomach acid one way or another. And then as those foodstuffs are broken down properly, then you're going to have a much better chance on not creating a histaminic response deeper in the intestinal tract. So it might be a bit of a roundabout answer. All I'm trying to demonstrate is that stomach acid is one part of the gut. It is a very important part, especially with histamine, but it is part, it's not the end.
Mm-hmm, mm-hmm. Great. And so how would somebody know if they're histamine sensitive?
So there's a couple ways. In our practice, there's a couple ways we do it. Number one is we look at histamine-rich foods. And as we mentioned earlier, avocados are on that list. There's a whole slew of foods that are rich with histamine. If you're noticing that you don't do well with fermented foods like sauerkraut, for example, or cured meats and deli meats and things like that are other examples, different types of alcohols. Those can be an initial clue. There's sort of three ways, I should say, that we look at it. One is eliminating those foods and then bringing them back in and see how the person does it. The second is there are tests available, and depending on where you are in the world, you may or may not be able to have access to these tests, but there are tests that can measure whole histamine and something called DAO, which stands for diamine oxidase. And diamine oxidase is literally our body's own chemical compound that neutralizes histamine. And so there are labs that can measure those ratios and to see how your body is producing that. And the third is I like to do what's called the quercetin test. And I love quercetin. Quercetin is a wonderful antihistaminic. It's a natural supplement, is wonderful for gut healing. And there's also some great evidence right now that it is showing to have some great immune support to viruses. And I won't name one in particular, but I think we can all think of one at the top of our head. And there certainly seems to be some thought and some studies that are starting to sniff around that for that reason as well. But those are three ways to kind of consider histamine.
Okay, great. Thank you. And I think for those on the call who haven't really heard of histamine before, and we've kind of just dove straight into the details, what is histamine? What is it meant to do? Why is it an issue for some people, etc.?
Well, histamine, I mean, we all have it. We all need it. It's part of our inflammatory context. It's a part of our body's ability to alert ourselves when we're dealing with an allergen or something that can trigger an allergen type of reaction. And, you know, as I said, these are things that if we are eating foods that are rich in these and you have a predisposition to a histamine imbalance, whether you are low in DAO or your body is literally producing or has an intolerance to histamine. And I find the word histamine intolerance gets thrown around a lot, where in fact it's a histamine imbalance. We want to understand a lot more about the person. And then that's why we have to, when dealing with functional medicine, we want to make sure that we're really focusing on that person's unique response versus a label such as histamine intolerance. We just got to make sure that we're deducing what exactly it is.
Okay, great. Thank you.
And is wine a potential issue with people with histamine issues?
Yeah, sadly. Yeah, some wines are worse than others, and some, you know, different alcohols as well you want to be careful with. And I find the clearer the alcohol, usually you're going to have a little bit of a lower reaction, but virtually, you know, any alcohol can trigger different levels of histamine.
Okay, great. And Veronica is asking, she is having issues with eczema, and she's wondering if high histamine foods would contribute to a flare-up.
Certainly can be. I would look at all sorts of different types of reactions, and foods are where we begin. We see a lot of eczema in our clinic, and there's differences between a histamine intolerance or a histamine reaction to foods. There's also different types of antibody responses. And we can have what's called a food allergy, or we could have a food sensitivity, we could have a food intolerance. And these can be measured by different antibodies. IgA, IgG, IgM, and IgE are different markers that we can actually measure. Different labs will do either all of them together or they'll break them up into individual antibodies, and they can give you an idea of the level and the type of reactivity. And I find that that is a really good spot to start with when it comes to eczema. Histamine, I don't put that on the front burner right away, because we see so many people actually clear up their skin when we identify what foods are promoting an immune response as opposed to a histaminic response. We also see a lot of eczema related to different types of dysbiotic organisms in the gut. They could be parasites, yeast, bacteria. There could be low good bacteria. It's not always about the bad things. And oftentimes we will measure people's nutrient levels, and we'll see a lot of deficiencies in different B vitamins and different minerals, and especially omega-3s. And so those are just some nutrients to consider as well. And if it's ever possible, and you'll hear me say this a lot tonight, if it's ever possible to measure these things, then you're really going to be able to understand what your unique deficiencies are. And that's really how it starts to create a really powerful healing response. We want to make sure, again, that we're not always just treating a label, we're treating that person who has that label. And that's really important to understand.
Great.
Awesome.
Thank you. Before you spoke about acid reflux, what are your thoughts on bitters, using bitters to stimulate stomach acid?
I love them. I think bitters can be very helpful. And in fact, I've lectured on it before. I love that bitters are just a great superfood when it comes to regulating digestion in general. But there's other ways to do it as well, right? Betaine HCl is a wonderful way. If you've got or suspect you have low or weak stomach acid, this is known as hypochloridria, then you can actually take something called betaine HCl, which is a plant-based supplement, and that can start to stimulate your body's own production of HCl. There's other ways to do this. You know, there's a milder, gentler form, and that's even using apple cider vinegar to some extent. And there are some nutrients that are really really helpful to start your body's own production of stomach acid as well. So bitters, HCl, different nutrients, those are good things to look at.
Awesome. Thank you. Okay, we have a question here from Anne. She's asking about Candida, and she's saying it's a difficult infection to treat. When you've changed your diet and added supplements with no success, practitioners look to parasites, heavy metal overload, hormones, environmental problems, and so on as contributing factors. How do you support yourself as you work through the process? Okay, so one, I guess, what are your thoughts? How do you go about treating Candida? And I guess the question here is more like, how do you deal with, I guess, a Herxheimer response is what it seems like Anne is dealing with as well.
So just to get some clarity, are those things that this individual has done? Have they looked at heavy metals? Have they looked at the parasites and the other?
It seems that way.
It seems that way because now she's working through all these different things, and she is having so much inflammation. She's finding it hard to sleep. So I guess she's not coping with the protocols that she's dealing with. So
well, that certainly sounds like a Herx could be part of that. And for anybody who's new to this definition, a Herxheimer reaction is a die-off reaction, and it can be very problematic. It's limited information here, but that's certainly where I'd be looking at. And usually this is it's almost like the analogy of letting the dam open up too fast. We want to slow that trickle down a little bit. And it's not that we can't use those tools, but if you're detoxing heavy metals at the same time that you're trying to kill yeast with antifungals, that you're going in there and blasting out parasites and viruses, that can really create a lot of stress and demand on your emunctories, which are your detox and elimination pathways. And if you overflood those, then it just becomes overwhelming. And that's why you don't want to be downstream of a dam that blows open. So what we can do is we can slow that down and address them either one at a time. And maybe that's what this individual is doing. I believe it's Anne. And if that's what's happening right now, I would look at breaking them down one at a time. And really, if you do have elevated mercury, that is a big factor for not knocking the Candida out. Mercury and Candida love each other. If one's in there and the other's in there, they're hanging on to each other for dear life. You've got to break that apart and knock them down. There's a tremendous amount of research on that. And if there are parasites in there, like all of that stuff, what it's doing is draining on this vitality of this individual. And you've got to they're like anchors. You've got to cut these anchors off one by one so that that body's own innate force can come up and start to create a healing response. If it's a Herxheimer, you go slow and low. And don't be afraid to stop everything for a week. Bring everything back in at a quarter dose. If you can work your way up to a third dose or a half dose, don't rush it. But that's something that is very real, and it can be really bothersome to people when they move a little too quickly, or they're doing a lot of things of this nature at once.
Great, thank you. Would you recommend any additional herbs and supplements to help with die-off, or is it more just slow down?
Well, I'm not sure precisely what she's on, but when you're releasing toxins, you want to bind to them. You want to make sure that they're being bound up and not necessarily seeping back into the system as well. So it's one thing to go in and remove metals from stored places and start to, send them back into circulation, but you want to make sure that they're being bound up and excreted. So there's lots of great binders on the market right now. Even just very simply, you can get bentonite clay and psyllium husk, for example, and there's great formulas that can really start to seep up a lot of toxins that happen when you're killing organisms, such as parasites or fungi or bacteria for that matter. They're filled with all sorts of different toxic debris. And if you're releasing a lot of that, that's part of what creates this Herxheimer response. And you need that sponge in there to bind to these and knock them out. And there's much more sophisticated products on the market. Friends of mine at Cellcore, they're doing a great job with all sorts of products. Dr. Todd Watts and Dr. Jay Davidson have some great formulas, and I would encourage everybody to check out their products as well.
Awesome. Thank you. Great. Okay. So we have lots of skin questions today. Okay. Where was the first one? Okay. Elizabeth, I've had problems with excessive itching over the last few months, especially on my back. Any ideas what might be causing that? I've been on Gut Restore for about 4 months. Do you think they are related or other gut dysfunction? Obviously that, yeah.
Yeah, the skin and the gut are intimately connected. You know, there's a lot of factors that can cause itchy skin. Obviously, make sure that there's no immediate contact issues, like if you changed your soaps, your shampoos, your laundry detergents. That's some pretty easy low-hanging fruit, but most people kind of move past that and are already diving into the deeper stuff. But it always shocks me that somebody's like, oh yeah, I switched our detergent last week. You know, it's just always look at some of those easy things first. But yes, getting into that gut work is huge. And once again, if you have that ability to run a test, one of my favorites is called the GI map. And this can really start to expose a lot of imbalances in your bacteria. It can start to expose any imbalances that would start to suggest that there's leaky gut, such as, you know, protein markers such as zonulin and even calprotectin, which is an inflammatory marker. These are great tools. But look at the foods. Look at how your body's responding to food. Just because you were responding fine up until a month ago or 3 months ago, your body can change. And there can be events in our lives that suddenly allow us to become more sensitive to a food that never bugged us before. So I'd be looking at really understanding how the gut is being impacted. It sounds to me like there could be something going on.
Great answer. Thank you, Dr. Dempster. Okay, Gail is asking about hives. What might be the cause of hives that occur intermittently and are focused on the buttocks and stomach, generally in the evening after dinner?
Ooh, the evening is a bit of a clue. Whenever things start to peak up in the evening, I always think parasites. Now, that's not to say that this is the only thing, but parasites tend to become more active later in the day, especially in the evening. And parasites are really notorious for hives. Now, food has a massive responsibility for hives as well. And so you do not want to overlook that. And some of the classic foods are obviously gluten, dairy, sugar, soy, egg. Keep an eye on those as well. But make sure that you are running an IgE test for sure. And if you're capable of getting the IgA, IgM, and IgGs done as well, it never hurts to look at that full panel. But I'm thinking parasites, make sure that you're running a proper parasitic panel. If you can do it in a DNA PCR type fashion, that's the most accurate way. And there's a number of companies that are doing that very well.
Wonderful. Great. I love the detective work. Oh, we have a clue. That's great. Okay, well, we're working through all the itchy questions. This is Julie from Wichita. What causes itchy eyes? When I detox, I get itchy or dry eyes, possibly histamine release?
It could be. It could also be part of a gentler form of a Herx reaction. You know, if you mentioned that you're detoxing, look at how and what products you're bringing in to detoxify yourself. Some people do not do that great in saunas, and that they would use saunas for a detox purpose. Some people are taking all sorts of different botanicals, and some of these botanicals can be allergenic to them. So pay attention to, you know, if you've got any history of allergies, start to do some sleuthing work and see if any of the products that you are taking are linked in the same family tree. And sometimes that can happen. You might see that there's some connections there. But itchy eyes is also, I mean, it's a mucous membrane. And, you know, it's not the main way of excreting toxins, but it could be some part of your body saying, hey, you know, this is part of my detox pathway here, and I'm eliminating as best as I can in all directions.
Mm-hmm. Okay, great. Thank you. So Hona's skin question. I've been experiencing perioral dermatitis for the last month and my symptoms are not improving. Can you recommend any natural remedies without using prescription medicine? Thank you.
Sure. Yeah, I had a case come in a couple of days ago, and we had seen her 2 weeks ago for the first time, and she came in this week and her perioral dermatitis was gone. And it was great. We've seen a fair bit of that over the years, but everyone's different. And again, I'll always sort of say that, but this one was really interesting because what we did is we identified right away some nutrient deficiencies that she was dealing with. And there were certain B vitamins and zinc and omegas were a big deal. And if I recall offhand, she was also low in vitamin E, but really look at zinc and look at the B vitamins. Those are very common nutrients linked to perioral dermatitis, and also really make sure that you get on a probiotic as a gentle first approach. I'll just sort of qualify probiotics for a moment. They're not all equal. And anytime when I'm referring to probiotics, my minimum starting dose is usually around 100 billion, no less than that. And if you start to look at products on the shelves of stores, there's lots that will be at 100 billion, but there's not many that are going to be much more than that. There are definitely out there, but you want to make sure that you're not getting too little, and you want to understand that if you're getting a certain quality of supplement, it's going to be guaranteed that that amount is going to be in there until expiry. And so not all products can say that. And so when you're dealing with probiotics, I hear all the time about, oh, probiotics didn't work. And then when I start to ask, I say, well, what type of product were you using? Was this a professional grade? Is it something, or is it something that was just found at the local drugstore? And that's not to be disrespectful to any company. It's just that there's a big difference. And so make sure that when you are heeding some of the advice that you're going to learn about supplements, make sure that you are dealing with good quality supplements, probiotics for sure.
Wonderful. So good.
Do you have any recommendations for where to get like some of these really decent
brand
probiotics?
Names that you could,
and you can, if it's your own, that's fine.
If you have a line, let us know.
No, I mean, I'm in Toronto, of course, and so where we get our supplements might be different where everyone's listening across the world. But you're going to want to look at products. The ones in North America that are very, very helpful are going to be products like Zymogen contains a very good starting, what I like, 100 billion. They contain a very good probiotic. Metagenics contains very good, great probiotics. Orthomolecular Products, Thorne. These are some names that you can start to look for. There's a lot that are out. There's about 12 companies that we use for our probiotics, but those are some of the main ones.
Okay, great. And we do have listeners from Canada and Toronto specifically here on the call. So just so you know, you have some locals. Awesome. Okay, cool. All right. Anonymous attendee. They had a UTI, took antibiotics, but taken off after 3 days due to digestive system meltdown. Any recommendations for rebooting my digestive system quickly?
Definitely get on a post-antibiotic probiotic. The starting dose that you're going to want to look at is between 500 to 800 billion. Always run this past your medical doctor or your primary caregiver. These are just good general suggestions to look at. If there's been some post-antibiotic irritation or damage done, you're going to want to consider going on a glutamine supplement as well. And L-glutamine is a very powerful amino acid that can really start to heal and repair your enterocytes, which are your gut cells. And oftentimes, if somebody has that type of cathartic reaction from an antibiotic, there's some repair work that needs to be done after that. And I would also be looking at a very specific strain of probiotic called Lactobacillus salivarius. Lactobacillus salivarius is just one strain of bug that some companies can carry that can really start to heal the tight junctions that get damaged in some cases of post-antibiotic inflammation.
Salivarius. Great. Awesome. You are like smashing through these questions. It's great.
I know, considering your wife's about to give birth, you're just very focused.
Okay, great. Let me see. Are there any foods that can provoke migraines, or what to avoid? What is helpful for migraines?
So I think there's some common themes in our threads tonight. Definitely look at food sensitivities. It's one of the first tests I'd be running on somebody with chronic migraines. I'd also be measuring their nutrient levels once again. And the common threads that I see in the nutrients are going to be things like magnesium deficiencies, different B vitamin deficiencies such as B2 and B6. Look at those. But from a food perspective, histamine is a big factor. Also start to consider oxalate foods that are rich in oxalates. Now, what's frustrating about this conversation is oxalates are in everything. And I have seen patients who are quite reactive to oxalates, and the only actual diet that's worked for them, and it sounds very extreme, was them shifting to a little bit more of a meat-based diet. And that's not for everybody, believe me. But that's where some of our chronic migraine patients have seen relief. Many patients have done well without going to a carnivore diet. I don't want to go down that rabbit hole right yet. But a lot of people are doing well when they're cutting out those typical tyramine-rich foods. And those are going to be a lot of the cheeses, the chocolates, be very careful with alcohols and so forth. But get your foods tested. You name the food right now, even the healthiest food, I've seen somebody react to that from a migraine perspective. And we wouldn't have known it unless we had run the blood work. That's
right. Yeah, interesting. So with people that have food sensitivities, you obviously if you have a leaky gut, you're going to react to a lot of things. do you help people, I guess, recover from their food sensitivities after eliminating them from their diet?
Definitely. And we've seen people who have been extremely reactive to the point where they were anaphylactic. So they had an allergy, a severe allergy that down the road, and it takes a long time, and not everybody can do it, but some people have beaten their anaphylaxis, and that it's never our goal to rush that and get them off their meds. But some people are like, hey, I accidentally ate a peanut last night. I did not have a problem. So sometimes that we have literally seen that happen. When you focus on treating the gut, good things happen. And so you want to make sure that that foundation gets set and you build on that. And we talk a lot, as you know, about leaky gut and intestinal permeability. It's not the only factor of the gut that's going on, but it is certainly something that, it really does need to be addressed in a lot of people.
Great, thank you. And what is your favorite test lab for food sensitivity?
So we actually work with a number of them, and depending on the patient, we'll handpick which one. So we will either break it down and do individual antibodies. So it could be any of the four. It could be, we could just isolate an IgG, do a panel on that, or IgA or IgM. Or we could do, and one of my favorites is using a blended panel. So it's measuring the reactivity to all those major antibodies. And this is a company called ELISA Act, and they're in the US, and you can look them up.
Wonderful. Thank you. Catherine is resonating with what you're saying. She's saying so very true on the issue of food sensitivities that cause migraines. Mine was spinach, which is like not a food that you'd expect.
That's an oxalate-rich food.
Yeah, that's right.
So careful with that. So good job, for identifying that, Catherine.
Yeah. Okay, so let's see here. This is from Philip. I understand that if we can heal the gut, the body can start to heal. I'm taking many probiotics. What do I need to get rid of my epilepsy? I don't know if you have many or any clients with epilepsy, Dr. Dempster. I didn't always have it, Philip said. I heard about the gut-brain connection. What else can I do?
So I would really start to do a full systems audit on where the inflammatory triggers are coming from. And epilepsy is not a simple thing to treat. I have worked with a number of patients with it. And oftentimes we're seeing a combination of different inflammatory assaults to the gut, but we're often seeing some real deep nutrient deficiencies. And they can be all sorts of them that are involved. Each nutrient that we measure, we measure up to 35 different nutrients, and each nutrient can have 200 to 300 jobs that it's meant to do every second in the body. And so if we are missing one, we're way behind. If we're missing a multitude of nutrients, you can imagine the exponential impact. So when it comes to epilepsy, it's a very serious situation that we want to make sure that we're really treating that individual. But we're seeing some really good impact when we really tighten up the diet and eat clean, get rid of the inflammatory based foods. You've got to be very careful with gluten. You're going to hear that a lot these days. Gluten can be a neuroendocrine disruptor, which means that it can totally disrupt our nervous system. And I've been fortunate to listen to some of the brightest minds at Harvard discuss this, and Dr. Alessio Fasano being one of them is the lead researcher in this area. And he says, just don't touch it. And some docs are even going further and saying, you got to be grain-free. So these are things to consider. Grains, not all grains are bad, but for some people, they have a real strong sensitivity to all the grains and the molecular mimicry that goes on with grains and the gluten receptors in our body. So really be focusing on understanding what foods are promoting inflammation, get the gut tidied up, really make sure that you're not dealing with any toxicity such as mercury, lead, arsenic, cadmium. Make sure that you're running a heavy metals panel to understand that. And I'd be really pumping in different forms of very powerful fat-soluble nutrients. So really getting that vitamin D assessed properly. There's a very exciting product that I use a lot for different types of neurological conditions and pain conditions, and it's called SPM. It stands for Specialized Pro-Resolving Mediators. And it's a very distilled version of fish oils. It's not going to replace your omega-3s, but it comes from omega-3s, and it's a very condensed form, these active constituents. And they've only been on the market for about the last 4 years, and they're doing some very powerful things. So I'd be starting to look into some of those directions.
Interesting. Thank you. Okay, cool. I want to ask you about so many things that you just mentioned then, but I guess this question ties a few of them together. Hannah's asking, over the last 9 months, I've developed a massive number of high-level food sensitivities. I'm being treated for copper toxicity, but my levels are taking time to be brought down and is still quite high. Can you speak to the food issues that might be linked with copper toxicity? Does the mast cell activation syndrome have anything to do with it?
So that's interesting. Copper does exist in foods, but it doesn't exist in super high amounts unless you are really condensing your food. So I'd be interested to know if this person is doing any form of juicing, if they're really focusing on monotherapies. You know, we've got to be careful with, the more we learn about food and nutrition, oftentimes we can become very, very extreme in our eating. So I'd be really making sure that you're balancing out the minerals. You know, the zinc copper ratio is really important to balance. And if you're just really hitting the copper hard and you're not getting enough of zinc rich foods, you're going to have a harder time balancing that copper. So I think there's a bigger question going on here. I don't know if it's just about eating the foods here. I'd be looking at understanding what's going on with zinc. Why is your body, like, make sure that you're testing your zinc levels as well, because there's a good chance your zinc levels may be knocked down. If they're not, then we've also got to make sure that we're not bringing copper in external forms in our environment. And copper can be in other ways. Is there any types of alloys that you're working with, you know, in a workplace environment? Are you on any medications that maybe potentially contaminate or have that trace amounts in there? I'm not sure. Really look at that.
Yeah, Hannah, are you doing any juicing or anything to contribute to your possible high toxicity copper? Actually, we had one of our friends' sons he had lots of anxiety, and it was discovered that he had very high copper, and they discovered that he was actually drinking out of the shower head during his showers, and so they thought that possibly could have been where his copper came from.
Yeah, that's what I'm kind of thinking. Like it'd be tough to get that from food unless you're just really hammering down on a concentrated version of that. But I would be looking at the environmental exposures as well, as well as I mentioned earlier, the zinc, make sure that that's balancing it out.
I think I remember you were one of the first people that explained, or when I first heard sort of how one mineral deficiency, because you're saying, oh, just make sure your zinc's okay, but a lot of people are unaware of the downplay effects of that. So even just if you could single out something like zinc and explain what are some of the down road effects that people may not be thinking or associating with the zinc deficiency.
Sure, there's some definite clues that you can look for with zinc deficiency. The first thing is look for white spots in your fingernails. And if you've ever got white spots, that's usually a clue of a number of, or a few, very few number of, you know.
That's what I
The second is an affinity for black sweaters. Oh wait, sorry.
Oh, whoa.
Oh no.
All kidding aside, fingernails look first. That could also be indicative of selenium as well. But I'd be looking for that. I'd be understanding, do you have any issues with taste or loss of taste? That can be an issue. Do you get colds or flus frequently? Are you exposed? You know, are you picking up every bug that's going around? Zinc is a very powerful immunomodulating nutrient. And if we're deficient in zinc, we can start to be susceptible to regular colds and flus. So I'd be looking at that. I'd be looking for cracking of the skin. So again, back to that periorbital discussion earlier, zinc is a very powerful nutrient, especially when you're getting the actual cracks in the corners of your mouth, not just the whole rash and sort of redness around the entire area, but in the cracking in the corners of the mouth. That's some issues as well. Are you prone to acne? Another real key area that we see imbalances with zinc. So just some thoughts there.
Excellent. Thank
you. Okay, so we have lots of questions about detoxing heavy metals. Can you lead us through that?
Well, first of all, when you test, you don't guess. There's a lot of suspicions about metals out there, and I think that's good. I think it's great to be aware. It's also really important to understand what you're trying to detox and what you're trying to remove from the body. And with that, you need to have a roadmap. So this is where it is important. And there's different ways to get your metals tested. One is, well, I'll mention the two most helpful ways. One, the best way is called a provocative urine challenge, which is where you would actually do a urine test and provoke the release of these metals into the urine sample. And that's something that you can do with most functional practitioners. The other is you can do a regular blood test, which is non-provoked, but that's going to be looking a little bit more for recent exposure. And metals are tricky because your body doesn't love having them in circulation. So if it's unable to remove them the second it comes in, then it usually tends to store them back into different adipose tissues and fatty organs and so forth, and oftentimes even in our bones. So we want to make sure that we're truly understanding what we're what we're trying to treat. So if you have mercury or if you have lead, which are two of the most common, identify the source. Find out if it's mercury. Make sure that you cut your high levels of big fish down. So tuna, swordfish, even some degree salmon. Be very careful with eating a lot of really large fish that can bioaccumulate. Get those mercury fillings, those silver amalgam fillings, get them removed, but get them removed safely. Don't just go in there and start digging away. Make sure that you're getting a biological dentist to get in there and get the proper ventilation, proper dental dams in there, and get them removed at an appropriate pace for your body. And that's really important. I come from 3 generations of dentists in my family, and this has been a big discussion. And it's really important that we don't push more debris into the body when we're trying to remove it from the teeth, which can happen. And again, I say this respectfully, there's a lot of wonderful dentists out there, but I've seen some problems happen from some of these procedures. And so we want to understand, the differences of what's going on. So make sure that you identify what metals you're trying to get rid of. If you find them, get rid of the source. Lead can be coming from other things such as pipes, paint, could be coming from leaded gasoline 30 years ago. A lot of my patients, it's from that. It's from when leaded gasoline was very popular and ubiquitous out there. But some of the general chelating agents that you're going to want to consider, and again, it depends on what the scope of practice is with your practitioner, but DMSA is a very safe, for a large amount of people, it's very safe. You always want to make sure because it is a sulfur-based compound. But it is very good at grabbing, almost like a magnet, lock and key magnet, grabs a hold of these things and it can start to bind them up, and then we want to facilitate removing them. But there's lots of wonderful plant-based ones as well. Chlorella has been around forever. Never overlook that. Spirulina. Never overlook even the power of glutathione and vitamin C. I tend to do a lot of high-dose intravenous vitamin C and glutathione treatments in my practice to help people remove these toxins from the body. And we infuse other nutrients as well, but those are great, gentle chelators. But even some hops derivatives are really nice botanical supplements that you can take orally that can be really helpful to pull this stuff out. Bentonite clay, infrared saunas. These are all very powerful tools, and you've got to match the treatment to the person.
Great. So many good options there. Thank you.
So if someone's detoxing, how long until, because obviously someone could feel worse before they get better. In your experience, I know that's like how long is a piece of string, but what is there a sort of a general guideline as to how people should be feeling as they're detoxing, and then how long until they should start to feel better?
Yeah, there's sort of this thought that everybody has to feel really crappy before they feel better. I really don't subscribe to that. I definitely advise my patients that this could happen, but it's not meant to be a rite of passage. If somebody's really white knuckling and struggling, you've got to slow it down, and you've got to find a different way to remove this. So, if you find that you are really feeling bogged down with the treatment, don't be afraid to take a bit of a break on it and potentially bring it in at a lower dose. This is all, parts of a Herxheimer reaction. It's not just about a die-off. It's also just about mobilization of toxicity. And if we're mobilizing metals at a quicker pace that your body's used to, it can overwhelm you. You can get really brain foggy. You can just feel lethargic and general malaise and all sorts of things. Lots of people's body aches come back too. So slow it down. Make sure that your elimination pathways have opened right up. So anybody who's constipated, you got to get your gut working first. You got to make sure that your lymphatics are draining properly, and you got to make sure that you're hydrating throughout these processes. So it's not meant to be a fast and a furious. When we do different types of heavy metal detoxes, we're doing it in pulses. We'll go 3 days on, 4 days off, and often on those 4 days, we're repleting them. And some of our patients who are really getting bogged down and we're going really slow, we will actually spend time on those on that off day by giving them lots of nutrients through infusions, and they feel a lot better that way. And that's not to say that everybody needs to do vitamin infusions, but those are people that are really run down. If anyone's listening has experienced that, that's something you may want to consider. Get the glutathione, get your nutrients and your minerals brought back in, because a lot of the chelators, the natural agents as well, and not so much spirulina or chlorella, but some of the DMSAs especially are going to be grabbing all sorts of other minerals. And it's really important to understand that this needs to be done properly, or else you can feel unwell.
Thank you. Yes, very helpful. For the chlorella and the spirulina, is there a certain dosage that you need to have for it to be effective for heavy metal detox, or is it just something that you would incorporate into your day-to-day life?
It's an interesting one. These are, generally speaking, superfoods, right? And depending on the density. There's not a standardization of these that are around. You know, some companies will be like, take 20 tablets of these a day, and in other companies it's in a tincture form. Like, there's different ways of taking this. So for me, I would always say, look, the dose is the regulator. If you're taking something and you're noticing that you're just feeling really rough, back it off. But there's no one standardized dose for chlorella. That's a tougher one to answer. But definitely look at the label. Definitely consider what they're recommending. And if you're really a sensitive person, you should know by now if you're a sensitive individual. Some of my patients, I call them lightning rods because they just amplify everything. And so you've got to take that dose down to 1/10 of the dose sometimes and work your way up.
Okay, great. Thank you. Okay, what about mold? Katia is asking about mold.
Any specific question about mold?
Well, okay, so what about mold testing? And then I would say a follow-up, how do you get mold out of your body?
Sure. So there's a number of things to talk about here. You can test molds, and you can test the toxins that come from molds. These are called mycotoxins. And again, depending where you are in the world, some of these tests are accessible and some of them are not. So you have to work with your practitioner who's licensed to do that. But mycotoxins are the toxins that are coming from molds. And these are things like ochre toxins, and there's all sorts. There's about 15 major players that you would want to be looking at. But they can be serious, and they can be really powerful neuroendocrine disruptors, and they can cause different types of carcinogenic activity in the body, which is not a good thing. And they can cause different types of neurotoxicity in the body. So mold is real. This is a real problem. And it is a ubiquitous issue. There's not too many basements, and we work with a third-party mold. I call him the mold doctor, but he's just a contractor that's really focused in on making sure people's houses are clean of mold. And he's got this very sensitive equipment. He says he has never seen a basement that doesn't have some small capacity of mold in it. And that's not to make everybody scared of the basement. I'm in my basement right now. The point is that, you know, make sure that you are looking at what's going on in your home. And you may be surprised if there's been ever any water damage. Do your homework and get that remediated properly. It can be a festering cancer that you can't see that is going to cause problems down the road. So don't take it lightly. But at the same time, don't be scared of your basement. The other thing is look at your food. Food is something that often gets wrought with mold exposure. And this could be live foodstuffs. This could be vegetables and produce and even legumes and nuts and seeds and so forth. And obviously we're all aware of the moldy cheeses that are out there, but be careful with foods, because this is the other big source of it. It's not always about water damaged homes. It can be coming through foods as well.
And then removing mold from your body, or is it just more of a limit the exposure type thing?
No, there are things that you can do to help clean that out. One of my favorite things is glutathione. Glutathione is a very powerful nutrient. And it's only effective in one of two ways. Well, there's a third way, which I'll get to, but either taking it in a liposomal form, which is generally in a liquid gel form, either in a pump or in a packet form. Not too many tablets or capsules, unless they are encapsulated glutathione liposomes, are effective. So make sure it is in that liposomal form. But intravenous is very powerful as well. So you're going to want to find somebody who is close to you that can do and is certified in IV vitamin therapy. Because vitamin C and glutathione as a combination intravenously are very powerful natural detoxifiers, and have helped a lot of our patients with mold exposure feel better. But I'd be looking at the third way, which is N-acetylcysteine, and that's a precursor to glutathione, and that can also be really helpful for starting to build up your body's own clearance pathways and detox pathways.
Do you use coffee enemas for glutathione stimulation? Yeah.
A whole other area of detoxification is using coffee enemas, and they can be extremely powerful. And I always chuckle when I hear that, because one of my favorite professors used to say, coffee's only good for one thing, going up the rectum. A lot of people that would disagree with you, but
a lot of addicts that would disagree.
Yeah.
So anyways, there is ways to do that, and that's certainly something that seems to be providing I have a lot of patients that swear by coffee enemas as part of the pathways. The other thing is you're going to want to look at binders as well. And, there's lots of different binders that are out there on the market. Even that bentonite that I mentioned earlier is a good example, but you can get activated charcoal and different bioactive carbons that are helpful tools as well.
Fantastic. Yeah, mold is no joke. We used to live in Bali, and if for anyone that's been to Southeast Asia, it's very wet. And so, if for anyone that has that has a mold sensitivity or anything, it can be rough. And Matt's actually one of those people. And our house we lived next to a river, and it had been flooded, and Matt was having such a rough time, and we didn't realize that it was the mold for too long. We weren't paying attention. So anyways, so for anyone that's looking for more reasons why they might not feel great, check your basement. Awesome. Okay, so BPA. What do you think might be the main cause of high BPA levels besides plastic bottles and canned foods?
Well, it is coming from something that's synthetic, so you've got to look there. And so, look for even the food, the bottles that appear to be tin or canned. They can often have a lining in the inside. Don't be fooled that can on the outside is can all the way through. Make sure you're checking that. Check your cosmetics. Big thing there. Okay. Check your toothpaste tubes. Check everything that you're putting in your body or on your skin, and obviously breathing it in as well. They're in plastic linings and tubes. So if you're drinking from, I don't know what type of dispensers you might be drinking from, make sure that these are not plastic. Your water bottles should not be plastic. They should be glass or steel, or some, degree of an alloy that's not going to leach. But those are things to be considering right away. It's definitely coming in through something, through either breath, through water, food, or skin. And you've got to look at those.
Great, thank you. Back on the mold thing, Jill is wondering, what is the difference between a mold allergy and mold toxicity?
Well, you can have an allergy to anything. An allergy is just an immune response, and that's your body saying, hey, I don't like you, you're a foreign object, I'm going to mount an attack against you, and then everybody else is going to get hit by friendly fire on the way out. So that's an allergy where your body sends in the troops to go and fend this off. Mold toxicity is literally the toxins of the mold, so these mycotoxins overwhelming your organs and burdening your body's detox pathways. So they can both feel very similar in some sense, but a mold toxicity is a very different reaction, because it can start to shut down your detox pathways and interfere with your detoxification processes.
Great, thank you. All right, this question is from Hope. She's asking, have you heard about a trial at Cedars Hospital in LA for red yeast rice to cure intestinal methane overgrowth? And what do you think?
So I heard of that trial. It was the first of a couple murmurings I'd heard about that with SIBO. I personally have not conducted much research myself, and I work a lot with SIBO. I personally haven't had much success with that, and I haven't used it. So, it caught my attention. And for me, I need to usually get my attention caught a few more times before I try something. But, it sounds exciting. It's a reputable place to be looking at doing some research. So I certainly wouldn't ignore that. I'm going to keep an eye out for it more going forward.
Cool. That's exciting. Okay, so just double checking. Can everyone hear okay still? Zdenka can't hear us anymore, but everyone, can you hear? Yes. Okay, cool. Awesome. Just checking. Okay? Yeah. It sounds fine to me, but we just had a comment, but I think it's just one person. Cool. Awesome.
I was wondering as well, with obviously having in some parts of the world a massive second wave of COVID. I don't think we've spoken to you about COVID as some of the best ways to boost someone's immune system, or some of the things that you've seen the most effective ways of protecting yourself from COVID.
So it's an interesting conversation, Matt. I'm going to be very careful with my wording. There is a lot of, I don't know how to say this, but we can't make any claims of anything that infers that it can cure or treat COVID.
Sure.
Or else it's a big problem for those who say that. I'm not saying that those answers don't live out there, and I'm certainly going to speak to you in another direction that might, that might lend some thought here. But I think what we need to always look at is, this is a virus. It's a very problematic virus. It's been devastating for some, and at the same time, there are things we can do to support our own body's resilience, and that's really where I think we can have this conversation of how do we support our immune system. So let's forget the word whatever that word is, for 1 second. And let's talk about what are some effective antivirals that we can start to talk about here. And that's really an important step. Zinc has got a ton of research on it right now. Vitamin D has been recommended by the British Prime Minister to start to be very effective. Well, he's not suggesting it's been effective. He's finally saying, hey, I want all my citizens to be taking this. And so there is a tremendous amount of research on vitamin D and specifically COVID. And that's the one thing that we can say because it's FDA approved. And it's got that sort of backing to say, but anything else beyond that, we can't necessarily say is going to treat or cure this particular strain of virus. It's a very challenging time for practitioners like myself because I feel like we have so much to say and so much to offer, but we're being advised and being cautioned very sternly to be careful on how we infer this information. So I'd be looking at zinc, I'd be looking at D, I'd be looking at quercetin, very powerful. Always bring your medicine cabinet of vitamin C to the house, your glutathione to the house. These are very powerful immune support agents as well. And at the end of the day, we've got to make sure that we understand that looking after our bodies right now is how we can get our immune system up. If we're crushing sugars all day long and we're not dealing with all the different co-infections that are hiding out in our gut, that's a drag on your immune system. If we're not getting the proper sleep, the proper exercise, all this stuff we all know. But this is where now we're really in this pressure cooker, and it's not to say that healthy people aren't getting sick, they are. But the majority of people are having serious issues. There's usually some cracks in the manifold that have been going on there for some time. And we just want to make sure that we're taking stock here. And I say that to be very sensitive to everybody. This has been a very, very tough year. Mm-hmm. And I personally know people who've passed away from it. And I've had numerous patients come to me that I unfortunately was not allowed to treat because we're not allowed to accept them in the clinic when they've been diagnosed with COVID. So we've resorted to different strategies over the phone and so forth. And this is a big deal for everybody, and we're all going to get through it. But really look at those core immune support agents that I mentioned earlier.
Excellent, great advice. Thank you for that. Have you heard of any biofeedback machines in testing and diagnosing patients, or do you use it in your practice?
I don't use any of them. In fact, I was exposed to a lot of them a while ago, and it's just not a language that resonates deeply with me. It can work really nicely for a lot of patients, and I've had a lot of people have great experience with them. Some of the names that I've heard of are the Mora and the Meridian. These are ones to look for. I've done some training over in Germany about 20 years ago, and this is really popular in a lot of clinics over there. So I'd certainly say if you're interested in that, there's certainly practitioners in North America doing it, but those are some of the devices that I've heard that are doing great things.
Awesome.
Great. Thank you. Okay. Lorraine is asking about teeth grinding. It's been so bad that she's had to have her 4 upper back teeth removed. What could be the possible causes of teeth grinding?
First thing I look at is chronic stress and anxiety. And I'd be really understanding. You may not think that you're a stressed or anxious person, but your subconscious is a different beast. And so you want to make sure that when you're going into sleep, that you're going into sleep ready for sleep, not thinking about work, school, COVID, whatever else is going on in the world right now. Making sure that you have proper sleep hygiene and wind down before you go to bed. There can be issues with mineral deficiencies such as magnesium that are going to increase your ability to grind and chatter, but it often comes back to an active nervous system. So make sure that we're looking at that sympathetic dominant state, which is the fight or flight state, and don't be watching shoot 'em up movies, horror movies, and whatever it might be before you go to bed. Put yourself into the rest and digest mode. Get your parasympathetic activity going, do some mindfulness, do some meditation, take a Epsom salt bath, whatever it is to you, get your body into a deep, nice, relaxed state. And if nothing's happening with that, you've got to look into it a bit further. And I would start by looking at what's going on with nutrient deficiencies. And like I said, if there's any other activity going on in the evening, start thinking about parasites too. So sometimes there might be a gut connection there.
Yeah. I know that Jay Davidson said he'd ground down his teeth and he thought parasites was behind that. Yeah. Awful. But I hope that helps.
We just want to be sensitive with your time, obviously. So
baby.
Just as
let me do a quick. I'm doing okay.
Check your phone, yeah.
Call me. Okay. No, I'm okay.
Barbara saying happy new baby to you, your wife and your family, best wishes.
Yeah. Okay.
Yeah, we're okay. Let's keep going.
Okay. Awesome.
Oh man, you're a machine
I
tonight. You're
know.
just nailing these questions.
I think the
Yeah.
last time I went until my voice went, didn't I?
We really hit you.
You catch me at the end of a workday when all I've been doing is doing this all day, but I want to keep going. So let's keep going.
You're amazing. Thank you.
A lot of people would have been thinking this already. Do you currently take patients, or if someone wants to work deeper with you?
We do. Yeah, we do. And we're happy to. We've been a lot more restricted with COVID due to restrictions treating outside of our province. So people would have to come to us to see us now. And,
Okay.
and that's fine. We can do telemedicine, but you do have to be within the province of Ontario. So
Okay.
I know that's, that's not accessible to everybody. But yeah, we do accept new patients.
So if you're from Ontario, definitely.
Or if you want to come to Ontario, that's I guess what it comes down to.
Even for tele, you can't do anything outside of your state.
That's right.
Wow. Okay.
Yeah.
Cool.
That's
well,
rule that is in our province and not in many others, but it's in ours for sure.
Or if there's another resource that people that, if that's, you can legally give out to people to check out more if they wanted to get to, learn more from what you're doing.
An online program is specifically for those who suspect that their gut is involved. And this is why I'm so passionate about the gut. It's called the Healthy Gut Institute. I created it last year and it's an online program. It's a do-it-yourself program that goes really in depth into a lot of different modules and areas that we're discussing tonight. So it's not going to provide the testing or the one-on-one care, but it's going to give you a lot of the to-dos and what to-dos and what to look for and how to deal with it. I think we have over, I think about 4 dozen videos in there. I think we've got, about 60 different types of downloads and actionable steps and assets and resources. So this is something for people who can't come in to see us.
Awesome.
Cool. We'll just put a link.
Yes. So healthygutinstitute.com.
Yes.
I just found the link. Perfect.
Yeah.
Awesome.
Yeah, we love just you come across as very humble and just obviously when you start answering the questions you just nail them. But a lot of we know even famous people that come to see you. So for people that are watching and listen, you're a wealth of information. So we just wanted to also thank you for just making the time available.
Yeah.
It's so good. It's such good information.
Thank you.
Okay, so Lorraine is asking for your contact information. She's in Ontario. Oh, sorry, I accidentally started playing your video. You just blasted into my ears. So what's your regular website, Dr. D?
thedempsterclinic.com.
Clinic.com. All right, I'll pull that up so I can put that in the chat. So thedempsterclinic.com.
Yep.
All right, that's in.
For anybody who's got some general questions, we are more than happy to hop on a quick 15-minute call for anybody who's like, hey, is this the right fit for me? Is this something we do that as a courtesy for any new and prospective patient. And when you contact our clinic, just if you're looking to kind of take that dip your toe in step, that's something that we totally honor and happy to chat with you before you.
It's excellent.
That's great.
Yeah.
Awesome. Thank you. Okay. We'll dive back into the questions then. Awesome. Thank you for giving us some more time. So Vivi, this question comes from Vivi. What would be your best advice for hormonal balance in young ladies? I think through dieting and exercise and stress around my weight, I have unbalanced my hormones and my menstruation stopped for 2 years now. She's 5'2" and 127 pounds. Actually, it doesn't say actually. But she says she eats mainly very healthy, 60% vegetables, 20% meat, 20% fat. I stay away from dairy and refined sugars. And she's trying acupuncture.
The initial issue was it acne? Is that what I heard?
No, hormonal balance. So she she hasn't had a period for 2 years, and that's the main thing. Yeah.
Right. So there's a number of things to look at. Obviously, we want to understand the full context of the endocrine pathways. The endocrines are your hormone pathways. So, we're going to be doing a deep dive into understanding what's going on with the sex hormones. So what's going on with not only the estrogens, but all of their metabolites, progesterones, their metabolites, and then getting into the adrenals and their metabolites as well. And what do I mean by metabolites? Oftentimes when people go and they just get a core blood test done, they'll get 3 or 4 markers done and they're like, yep, I have my hormones tested. But when we do a hormone panel, we're getting about 5 pages of information. So what that means is that sometimes the info is into the metabolites, not just into the core hormones. And blood testing, trust me, can be very helpful. But we got to look at the thyroid too. All of these hormone producing glands, so your thyroid, your ovaries, your adrenals, those are the big ones. Even the hypothalamus is something when somebody stops having a cycle, I want to make sure that we're understanding the full connection. It's like having an electrical panel in your home and one of the lights goes out and you're not sure what wire went to that, but you've got to now assess the whole electrical system. And that's a conversation that we've seen a lot with, but there's some other things to look at, and I'm not sure if this is something that applies to this individual, but some of our real high performance athletes, so some of our marathon runners and triathletes and real endurance athletes are noticing that when they really put their body into a state of cycle, actually even some of my professional ballet dancers, their cycle is stopped. And so we've got to look at the impact of stress and trauma on the body and getting enough rest and repair, or sometimes it's even mental, emotional, or psychosocial. So a lot of stuff I'm sort of hypothesizing right now, but it starts by understanding the biochemical pathways, get those hormones tested. One of my favorite tests to run in North America is the Dutch test. Stands for Dried Urine Testing Comprehensive Hormones. And it's a very powerful tool, and it can really start to shed some insights in that right away.
Great response. Thank you. And on top of that, Vivi, I read a book a few years ago. It's called Period Repair Manual by Lara Briden. I think she's a fellow Canadian, actually. No, she studied it. Is she Australian? No, she studied in Canada. Anyway, whatever. I'm going to stop rambling. Anyway, it's a great resource for that, discovering your period symptoms as well. And I would say, just like reading that I'm eating mainly very healthy. I would say, Vivi, are you eating enough? Your body needs to have enough food to be able to have a period. Your body won't have a period if it's in survival mode, because your body obviously doesn't think it's a good idea for your body to have a baby right now. I would just add that in on top of Dr. Dempster's awesome advice. Thank you. Okay, so Jan is asking about adolescent acne. Why do some kids have terrible skin, and what can you do about it?
Well, for some, it's a bit of a rite of passage, but you can often really reduce the severity of it. And, it's adolescent acne is going to be triggered by hormones, and for a lot, but a lot of that hormones is kind of like you've got this little pilot light on, and then you suddenly, flood it with a bunch of other outside sources of gasoline, and that pilot light becomes an explosion. So we want to make sure that we're understanding what's going on with the inflammation in the body. I've seen a lot of adolescents with acne, and some of them just completely annihilated it and gotten like clear skin by looking at certain mineral deficiencies. Really pay attention to zinc, really look at your omegas, and you can measure your omega profiles. There are different tests that can give you an idea. It's not just about omega-3s. You got to understand if you're getting too many omega-6s. What's the typical adolescent diet? Well, we're not going to generalize, but we are going to generalize. It's not always the healthiest diet, right? And so there's usually a lot of that carbohydrate rich and really tasty foods that are going on. And those are generally very pro-inflammatory. And so I'd be right away getting, even if it's male or female, I'd be looking at zinc, looking at omegas, and then getting them on a cleaner diet. It's not easy with your adolescent, but I'm telling you, those kids, they don't want to have acne. And as soon as they see one hint of improvement, they're motivated and they're sticking to it. And they're saying no to the pizzas and they're saying no to the chocolate. And those are foods that are definitely part of the discussion, but they're not the only part. In some situations, we've got to go a little bit further and measure a full nutrient panel, and vitamin A can be part of that too. But zinc and omegas right away have done wonders for a lot of kids.
Great. Wonderful. What about chin hair growth for women? It's been happening since she was a teen. What can help with this?
So find out what's going on with your androgens. These are your testosterones and your DHEAs and all their counterparts. There's certainly something going on there that is often derived from androgen excess or an androgen imbalance. And if this has been going on since you're young, I'd be interested to know if there's any polycystic ovarian activity going on there, which can often be a sign of androgen excess. And this, it's something that you need to do a bit more work on that. There's no magic supplement that's going to take that away, but you're going to want to make sure that you are understanding what your testosterones and your DHEAs are doing and your androstenediones and so forth. So get those measured.
Great,
If
thank
it is
you.
PCOS, though, if it is something to do with the ovaries and them being involved with the androgen excess, then you've got to make sure that you really start to clean up the diet and manage your blood sugar levels to a T. Start removing toxins from your body, and again, the gut is part of that. But really make sure that you're not putting anything with sugar into your system that can promote PCOS and aggravate it in that sense. Chromium is a massive mineral for PCOS as well.
Okay, thank you. Okay. We had a question. Sorry, there's so many places where people have asked questions, and just trying to find. There was a question about blood sugar, since you mentioned blood sugar, and I can't find where.
Here with sluggish thyroid and insulin.
Okay, yeah, let's go with that one.
So this is by Sumiya, I think. And so this is, your thyroid is a very critical organ. And I've seen so many individuals, largely female, but even males, that are having thyroid dysfunction. And this is that little butterfly gland that sits right here, but it controls a lot of your metabolic processes. So if you've got a sluggish thyroid that's been diagnosed, like this individual, you've got to make sure that you really start to pay attention to those foods that are inflammatory. Be very careful. There's different degrees of thyroid issues. There are autoimmune degrees, and then there's primary hypothyroidism as well. So you've got to differentiate that. But a lot of people are dealing with some sluggish, some degree of autoimmune activity percolating in the background. And going on something like an AIP diet, which is an autoimmune protocol, can be very, very helpful for eliminating those standard foods that are very inflammatory for thyroid. Gluten is right at the top of that list. But really start making sure that you're getting those B vitamins brought in, getting those minerals, getting your iodine levels checked and understood that way. Very critical. One of my favorite natural supports, well, there's wonderful botanical supports, but you can even start looking at desiccated. You don't have to start to jump onto to other synthetic forms of meds. But some people with more stubborn thyroid conditions, they do need a little bit of that kick. And when you're measuring your thyroid, and this is really important, don't just stop with TSH and free T3 and free T4. Make sure you get your antibodies measured as well in something called reverse T3. Your antibodies are called antithyroglobulin and antithyroperoxidase. And these often don't get screened for immediately, but they can let you know if there's an autoimmune component to this. Because even though it may be sluggish, which means it's not a full-blown necessary problem, it could be the sign of something that's already starting to happen. And if we can get that autoimmunity under control sooner, that really helps the person down the road. So that was one part of that question. The other part was insulin resistance, and they're actually both connected. Your insulin is your response to carbohydrates into the body and sugars into the body. And if we're having more and more of these, and our body is, slowly becoming resistant to that insulin release, we require more and more of that, and then it becomes an issue and becomes very inflammatory in our system. And your thyroid is so sensitive to inflammatory processes in the body. So too much insulin is going to start to throw off your body metabolism. This is where we're going to start to get that possible pear shape or even that spare tire thing going on around our abdomen and even into our thighs. So if that is something that we're noticing, that's a sign that your metabolism is starting to shift. And you're going to really want to double down on insulin and understanding those biochemical pathways. I mentioned chromium earlier. Chromium is a mineral that is very powerful for balancing insulin, but it starts with your diet. And you can't out supplement a bad diet. So you've got to make sure that you're looking at that, eating real foods, eating a really, this is where, the discussion of keto can be very helpful. It's not for everybody, but getting on a diet that's going to really keep your insulin levels under control is really important.
Alba is asking about blood sugar issues. Do you have any suggestions to address blood sugar issues? How do you help your clients keep it steady?
Yeah, I think I kind of just, we can dovetail off that last one. Make sure that you cut out those refined carbohydrates from your diet. So a lot of the flours, even gluten-free, be very careful of the gluten-free trap. It's a huge market right now, but gluten-free does not equal healthy. A lot of the gluten-free products are enriched with corn and they're enriched with sugar. And corn is interesting because corn is not a vegetable, it's a grain. And it's a grain that can actually speed up our insulin and our blood sugar metabolism really quickly. So that's just a little tidbit for everyone listening tonight. Don't fall into that gluten-free trap, but there's much more obvious foods out there that we're going to want to cut down on. Really get out of that standard American diet type of mentality where we've got the sodas and the chips and the desserts. And I would imagine most people listening tonight aren't that folk. So we've got to take it a bit deeper there, but there's different botanicals. I'd be looking at Google. I'd be looking at alpha lipoic acid. Chromium has come up a number of times tonight. There's a number of wonderful botanicals that can really help support your blood sugar. But also, and this is key, make sure you understand the component of stress and cortisol and what that does to your blood sugars. I can't tell you the number of patients I've seen who eat clean. And this is really awesome. This is showing you, the power of information that's out there right now. But they're still struggling with their blood sugar. And it comes down to what's going on with their cortisol. And cortisol is a hormone that comes from stress perception. And so oftentimes if we're constantly in that fight or flight, whether it's going from work to sitting in a traffic jam to coming home and having stress at home, whatever it is for somebody, that cortisol needs to be looked at as well. So those are just a couple of thoughts to consider.
Mm-hmm.
Awesome.
Roxanne's
asking about dark circles under the eyes. Is that an indication of anything in the body? She's had dark circles under her eyes for most of her life since she was a child.
Roxanne, don't judge. I've got 2 young kids at home and a wife. No, in all seriousness, there's a number of reasons for this. Food sensitivities are one of the first things I would look at, especially if this started in a younger age and has been persisting. Really cut out those inflammatory foods. Dairy is a very big culprit, especially in children. And really start to understand that if you're not seeing any headway with that, it is worth looking into getting some food testing done. Fatigue, there's no question that fatigue is part of it, but that is not always the excuse for most people. I really start looking at inflammatory triggers through diet right away.
Yes, perfect. Thank you. Okay, so you mentioned before about heavy metals and using IV vitamin C and glutathione. Yeah. What if someone wants to avoid UV? Is taking it orally effective or?
Oh, yeah. Okay.
Yeah.
Avoiding IV. Yeah. So sure. Vitamin C and glutathione are still very beautiful things to take orally. Don't get me wrong, but they're not powerful chelators. And the word chelate is just to bind and grab a toxin and remove it from the body. And so they can be effective, but they won't be as effective as an intravenous version of that. But there are, as I alluded to earlier, there's lots of oral natural ways to remove metals from your body as well. So look at different types of hops derivatives. There's a product called MetClear or MetalloClear that you can look at. They're very helpful, and there's lots of binding products that are out there as well. And if you don't like taking things capsule-wise, a lot of people really don't like swallowing things, or they get pill fatigue. Fire infrared saunas, and they're getting cheaper and more accessible to own home. They're portable sometimes, and you can start looking at those as well. But really look at that connection with yeast. If you've got high mercury and you've got high yeast, you got to get rid of them both, or else they're really going to be stubborn.
Great, thank you. While we're talking about yeast, what are your top tips for Candida?
Stop feeding it. Okay, so make sure that you're not putting in processed or refined sugars. That is a bomb for Candida. They love that stuff. But in terms of what can you take to help eradicate it, I love berberine, oregano oil, caprylic acid. These are some things to look at. Golden seal. There's lots of wonderful products out there. Make sure that you're putting in a probiotic. And again, it comes down to a good strong dose. Nothing less than 100 billion, sometimes even higher is warranted. Making sure that your mercury is gone. If your mercury is still in there, you're going to have a hard time knocking that Candida down. And so get your mercury down and work on that as well. But those are some good antifungals that you can look at. In some situations, and this is not to knock, this is not just to be about, everything that we can do is all natural. Some situations we do need certain types of prescription drugs, and that's that's the reality of the situation. Most of my patients do very well with the natural, but occasionally we have some really persistent fungal conditions, and you will need some patients will need that prescription. Just don't start at it as your first line therapy right away.
Yeah, great. For someone with a typical case of Candida, how long do you think it would take them to get that imbalance?
I always say it depends on the person, but in general, you can really start to make some headway in about 8 weeks. Now, it can take a lot longer than that. And it really depends on what's going on. Is there, if we're going in, we're blasting it, but we're feeding it pops and sodas at the same time, that's a problem. So, it really depends on the foothold, the amount of yeast that's going on there. There are tests out there that can give you an idea of the amount of yeast you're dealing with. There's more than one fungal infection that can be problematic. It's not always about Candida. You can have a species called Geotrichum, for example. And these are other things that can start to compound. And if somebody has a complex picture where they've got parasites, bacteria, yeast, and viruses, and I've seen that a lot where they've got all these things, that's going to take longer than somebody else. And so, if you've got a very simple case of Candida, you can really start to put a dent into this in 8 to 12 weeks and really start to hammer that down. And that may not sound like a fast amount of time, but when we're talking about fungal infections, fungus is stubborn. And that is something that we just have to realize that's the real reality of it.
Great. Thank you so much. And so what is your typical go-to with Candida in terms of, would you use a mix of berberine and oregano oil? And is there a certain supplement that you generally use or?
Yeah, so we actually have a multitude of different products that we lean on depending on the type of use we need to, but I like the blended versions. They can be really helpful. I used to use caprylic acid by itself a long time ago, but I'm using it more and more in a blended version now with berberine and oregano, golden seal, bearberry. There's lots of different things that you can start to bring in. But I'm finding most of my patients, when I do my yeast analysis, I'm not just looking at yeast, I'm looking at bacteria and parasites as well. And I've almost always seen some sort of dysbiotic bacterial imbalance as well. So we're doing some antimicrobials for the bacteria side of things as well too.
Fantastic. And for Oprah, yes, there will be a replay to this webinar. We'll put it up in we'll email it out afterwards. So you can, Dr. Dempster has said a lot today. It's such a great resource, this video. So I'm sure everyone will have to watch this a couple more times and take notes and all of that. So wonderful. Thank you. Okay. So Deepika is wondering what could be a underlying cause for joint pain?
Well, pain itself is an inflammatory issue. We need to understand right away, is this a structural issue or is it a biochemical issue? And so, first things first, is there an injury to that joint that's happened that could suggest that there's bone on bone, that there's a cartilage tear, that there's a tendon issue? Those are certain things to understand. But a lot of our patients with chronic pain come into us because they've been and had the imaging done and nobody can see what's going on. And so that's where we begin our work, and we often see some really interesting things in this situation because it tends to get overlooked in a sports med office. When if they can't be solved with a structural issue, then definitely start looking at your diet because you want to understand what's creating inflammation. This is where I mentioned earlier something called SPMs, and we are seeing tremendous success with the use of these specialized pro-resolving mediators. And there's a product out there called SPM Active, and it's just really helping out a lot of our patients with chronic joint pain while we are working at the underlying factors. We always want to treat the cause and not just put a Band-Aid on the problem. So consider taking things like SPMs, consider taking things like anti-inflammatory enzyme blends. Curcumin is a wonderful tool. Really make sure you're cutting out the nightshade family of foods. And these are very tasty foods. These are your tomatoes and your potatoes and your eggplants and your bell peppers. But those can contain compounds that can be really powerful for what we call arthritides. They can kick up different types of arthritis type of reactions in the body. So without me knowing the type of pain that this person has, those are some thoughts to consider.
Thank you. And I should say, she opened her message by saying, I am touched. So dear Dr. JD, I am touched by the integrated expertise you have acquired at a young age. I've gone through your Wellness Without Limits. My thoughts resonate with that. So anyway, you have a fan. What would be your thoughts for gas trouble for 2 to 3 hours after food?
So that it sounds to me like there is a fermentation issue or some degree of SIBO going on. Something's going on deeper in the GI tract if it's that long after consumption of foods. So I would really start looking at food combining. That's an interesting, easy thing that anybody can start to do. All you have to do is Google food combining, and you'll start to see different foods to mix and match and foods to avoid. You don't want to, for example, you don't want to have a lot of meats and starches together. You don't want to have a lot of proteins and fruits together. These are things that you can start to look at. But if you're having this after the fact and not a lot of the simple advice is getting you far, then you're going to want to get a SIBO test done. And this is a breath test, and that's the true gold standard way to understand if you have SIBO right now. And there's different types of SIBO. There's methane dominant and hydrogen dominant. And if you do have SIBO, then you're going to want to make sure that you address that properly. And I would definitely look at treating SIBO if it is that. Start it first without antibiotics. We can always resort to that later if we need to. But look at doing different antimicrobials that are very powerful. That can be an option there. But look at the fermentation and the food combining.
Awesome.
Good idea.
Well, you've certainly gone above and beyond the call of duty today, Dr. Dempster, and particularly considering your circumstance. So I'd love everyone that's on the call right now to give their thanks in the chat. It's been Julie saying, yeah, thank you all. It's
so helpful and great to be online.
But yeah, it's and considering your wife as well, our thoughts and prayers definitely go out to her right now. And you're just so relaxed.
yeah. I guess, what did you say? Is this your third?
This is our third. Yeah.
Okay, so you know the drill now.
Screaming upstairs, so I think everything is okay. But thank you. It could literally happen tonight.
Yeah, so if you look in the chat, you're seeing a lot of love come through. So that's so much love is hitting that chat right now. So we really appreciate it. And you're such a wealth of knowledge, and we always love your down-to-earth nature and just how sharp you are as well. Such a wide variety of different topics. It's quite amazing. And you're in our trailer.
Yeah, you're in our trailer. We just finished our trailer yesterday for our new series, Gut Brain Solution. And thank you for sharing your expertise for that series, Dr. Dempster. Yeah, and your interview was so good. We used it for the trailer again.
I'm happy to help and to help anyone who's listening. So if I can be of any further help, let me know.
Awesome. So for anyone that lives in Ontario and are looking for a great doctor, definitely hit Dr. Dempster up. His website is thedempsterclinic.com. And then if you are wanting to learn more about gut health from Dr. Dempster's perspective, and he has the 6-week program called over at the Healthy Gut Institute. It's the HEAL program, and here we go. And the link is in the chat as well. But yeah, Dr. Dempster knows what he's doing. So if you want to be looked after, definitely head his way. Awesome.
Thanks, guys. It's been a pleasure as always. You guys take care of yourself.
All the best with your new baby.
Thank you. Take care, guys.
Thanks. Bye.
Bye.
We'll just stay on the call for a tick more. So we had a question here about the gut brain solution that will come out in February. So we're busy bees over here getting that done. It's always, we went out of focus. A massive job.
Yeah, I was thinking we have to go, but we wanted to quickly show you the trailer. Do not go to the website yet because it doesn't
work yet.
You can't opt in yet.
Wait, let me actually open this before you. I wonder but will it play?
Maybe just use
Vimeo.
No. Are you guys wanting to quickly have a look at? Yeah, we will send you updates when it comes out.
But will they be able to hear my audio?
I think so. We'll see if this works. It may not work.
Okay.
Okay, so share.
Let me just go.
So now we'll just share.
Sorry guys, a bit slow.
Yeah, Jim.
I just don't want, because I don't want to go full screen because that will look crazy.
Oh, we don't have to.
But
so we're going to.
No.
Oh wait, no. Share. Let us know if you can have an audio check.
Let me get rid of some of these things. Can you hear this? Did you hear that? Where's the chat gone?
It just disappears.
What? Did we just?
No, it's still.
What?
It's there. You just know.
How do I get back? I'm sorry, everyone. Is it over there?
Here it is. Is it participants? Where did the chat go?
More?
Ah.
Okay.
Okay. So your audio is working. We can hear you. Okay.
See it, not hear it. I played it for.
Can you hear this?
It's just got music. Oh, they can't hear it.
We can't hear any audio.
Oh, sadness. All right. Well,
man. I don't know if that's something that we're doing.
You are screen sharing. There's a setting to turn on. Oh, Zena, do you have special skills in this regard? As you can see, we have not done this before. Cannot hear. Sad. Oh.
Optimize screen share for video clip. What does that do? Can you hear the audio?
Oh. Still not working. Okay. You were sharing your computer sound.
Okay, I think I fixed it now.
No?
Can we hear?
Oh, okay, I think we need to give up.
USB.
I don't know why it's not.
So it says we're sharing our computer sound. Oh, is it the output here?
No, but it's the speakers or input device. Maybe we have to turn off our audio and then turn on the. But then I don't want to turn off our mics. Input.
Someone said yes.
No, we should be able to hit both. Yeah. I don't know. Do you want to keep troubleshooting?
Oh, you didn't want to change that?
Well, I didn't know it was an option. That's input.
Input.
We don't want to share the speakers.
I don't know. It says we're sharing our, unfortunately. You are sharing your computer sound. It's saying that. Oh, man, that's annoying. Sorry, guys. We tried.
We tried.
And it says sharing computer, audio.
Oh, Douglas wants us to keep trying.
I could do it quick. Is there... You will see it soon. So we stop share. Just give us a second. We'll stop the share. I don't know.
Sorry, guys. We don't know what we're doing.
Share screen. Share that. Share, and we're sharing computer sound.
Yeah, weird. Oh, okay. It was. Let us know if you can hear. Let's hit play.
Can we hear this?
Can you hear the video?
Can we hear the video? Audio check.
Scroll down. Oh.
What? Yes? No?
You go. I'm guessing no.
Okay, so I think it's in your...
It's my privacy settings or something.
Yeah, is it?
I think it's because maybe we need to let Zoom have permission.
Where is that?
Sometimes I think with all the new updates.
Yes, so Donna could hear both. What?
Security.
Where are those settings for?
Accessibility, maybe?
No, I don't think.
It's already selected anyway. Screen recording. It's already selected. Input. Oh, no. Oh, we tried.
I thought I could hear it before very faintly. Maybe try turning it up.
Okay. Is that working? No?
And is that working?
No, okay.
That is so disappointing.
The text is helpful for anyone who just wants to read. Doesn't really have the same effect.
I don't know what's happening.
It's telling us that we're screen sharing and our audio is on, but it's lying to us.
What is this? You are screen sharing.
I'm sorry, my friends.
This is really sad.
Oh,
I was so excited to share with you guys.
Anyway, you will see it in January.
Camera, microphone.
Anyway. Oh, you guys are so graceful, full of grace for us. Thank you. Thank you, Monica.
We've sort of given up.
Okay. I think we might have to give up. Anyway, we're really excited about it. We're in the editing phase right now, and we're all busy bees getting it all together. But this is the last Q&A for the year. Melody? Yeah. Oh, Matt's still trying. Did you change any settings?
I just want to see if that thing comes up again. No, we didn't get any.
Brain health. It turns out that there is a very powerful gut-brain connection.
We know that about 60% of people who have depression.
Good work, Maddie. Okay, we're going to be quiet now.
Okay.
Yeah. Here we go.
So many people think that if they have a mood disorder, that the problem all exists in the brain, and that the way that they're going to solve that problem is only by addressing brain health. It turns out that there is a very powerful gut-brain connection.
We know that about 60% of people who have depression also have irritable bowel syndrome. We know that people with anxiety also have irritable bowel syndrome.
The reality is that when you affect the gut, you will affect the brain. When you affect the brain, you will affect the gut. You cannot separate the two. And I can say over and over again that if we have somebody that comes in who's dealing with anxiety or depression or even schizophrenia or even autism, we're looking at that gut lining. We're looking at that gut function as the first and most critical important step to do.
Because a leaky gut becomes the most toxigenic thing to the brain.
This information desperately needs to get out to the general public.
She came back to me at her follow-up visit and she said to me, my gut feels so much better and my anxiety's gone.
And she started to notice that she wasn't going into the depressive episodes as much. And then she wasn't going into the manic episodes as much. And over time, they got further and further and further and further apart as we worked together. She ended up off all her bipolar medication. Her doctor was shocked, and that gave her back her life.
I've come from a place of thinking my life was over at 32 years old to a place where I am thriving.
If I didn't look at the gut, I would never be able to reverse the kinds of conditions that I've been able to reverse. If you've been having a hard time figuring out how to get better, think about looking at what's going on in your gut, because you may find the answers there.
You're not doomed. It's absolutely possible to heal, and I would look at your gut.
This docuseries is going to be a lifesaver for you. Finally, you're going to find the answers you've been looking for.
Hi, my name is Sarah Otto, creator of the Gut Brain Solution Masterclass. Learning about the gut-brain connection changed my life. and I know it has the potential to change yours too. Both my husband and I were able to recover from our debilitating depression and anxiety by healing our guts, and it is now our mission to share this life-changing message with the world. We are screening this special masterclass for a limited time only, and I invite you to come watch for free. You'll discover the latest cutting-edge science from world-leading experts who will teach you how you can unleash the power of the gut microbiome to heal your mind. This is your opportunity to find the answers that you and your family deserve. Enter your name and email now to secure your free pass to watch this once-in-a-lifetime event.
And
there we go. So
What
would
do
love
you think?
any feedback. What do you guys think?
Oh, great. Awesome.
It still hasn't been released to the public, so you guys are the first to see it.
First to see it. I only uploaded it yesterday. Beautiful. I'm moved. Awesome. Where
That's
do I
cool.
sign up? Oh, yay. Oh, you guys are so encouraging. Oh,
That's cool.
awesome.
Anything, what stood out? Anything, any feedback? Because you guys are our first market and the participants to be watching. What stood out for anyone? Is any just general feedback? It can be good and bad as well. 'Cause
Yeah,
it's not
it's anything
public.
weird.
Was it clear to what we were trying to communicate? Hopeful. That's
Oh,
good.
good.
Anything that wasn't
Okay.
clear, or do you think?
Oh, you guys.
So much hard work.
Oh. Yay. Oh,
that's
Maria.
Like the examples of a few successes. Cool.
Okay.
So maybe we could even,
Have some more.
yeah.
Oh, good. Awesome. Oh.
The reason why we're actually doing the gut brain was because of you guys as well. We surveyed
That's
after
right.
the gut solution and what you wanted to hear about the most. And everyone was about gut brain axis was all the rave in our responses. So
Yeah. That's what you guys
you
want.
guys are the reason we're doing this. So hopefully it works.
Hopefully you like it because it's for you. Oh. Okay, awesome. Oh,
Awesome.
great feedback.
And instead of it being like I think docu-series, we wanted to make it more in depth. So we made it like a masterclass. And so we wanted to, hopefully. So technically it is really a docu-series, but there's a lot more. We want to do a bit more teaching and
I don't know. The speakers are eyeballing the camera this time, so I'm not sure if that. Anyway, we're just trying something slightly different. We'll see how it all comes together. But thank you for that very, very kind response. I feel that's really nice. How long will it go for? It'll be a 10-part masterclass. You guys are stuck with us.
True.
Julie from Wichita.
Wichita.
Awesome. Oh, lovely. So you guys got to see a little snippet of our home in Australia too, our beaches. We were very proud of those.
Did you like the beach shots?
Yeah. Us Aussies are very proud of our coastline. But yeah, we love the beach. So I'm glad we got to show that.
Show it off to the world.
Yeah.
Cool. Any extra feedback, let us know. Glad it looked visually appealing and stuff like that. And anything, just email us in if there's any specific, obviously a bit more than what you could fit in this chat. Any feedback from even what you're seeing with you guys obviously watch other series and things, and what you would wish there was potentially in a series, or if they didn't do this or they did that better.
Yeah, if there's any events that you're watching and you're just like, this is really good, this is I find this very valuable, please write in and let us know what you liked about it, because we're always trying to find ways to do better, how to help more, because obviously we're just kind of putting out resources and seeing which ones are really resonating. So you can just write back to any one of my emails.
Emails are great.
Yeah.
And we'll get that forwarded to us.
Yeah.
And then, yeah, that's awesome. And anything specifically the gut brain axis that you've learned that you think, oh man, you've got to put this in the series. So we're currently putting all the episodes together right now. So there's still an opportunity for you guys to impact that. And so that
get your feedback in soon though, because we're really
it has to be soon, like this next
time.
Week. So if you got a good Christmas present for us, will be that for sure. Too.
Yeah. This Brenda, it's so true. Anxiety has gone up massively, and depression this year. So
many people are suffering from it, and I think their guts. People wouldn't realize that their guts are totally dysbiotic now.
Yeah, because obviously, as we all know, the gut is brain connection is a two-way street. If we're anxious, it's going to come out as gut dysfunction. If we're having gut dysfunction, it's going to make us more anxious and depressed. And so I think this message is more important than ever with what we've all been through this year. COVID did not help our gut brain situation for sure.
Awesome.
But yeah, Steve, I wish I knew this knowledge 35 years ago. Yeah, that's right. I think it would have been helpful for all. Awesome.
Great. Thanks, guys.
Well, thank you all. You've warmed my heart today. It's really nice.
You're just battling away with this thing for months, and you just go, is this even people even gonna like this?
Yeah, I'll pass on the feedback to the rest of the team as well. They'll be happy to hear what you all think. Awesome. Well, happy holidays, happy new year. I hope wherever you are in the world, you get to enjoy it. Obviously, some of us are in more restrictions than others, but I hope you'll find a way to wind down and love and appreciate your friends and family as we wrap up. 2020. Good riddance, 2020.
2020 was one of those things, hey, but we're glad that at least we had this, right? I think this has been one of the highlights for us in the business.
Yeah, that's right.
Is doing this with you this year.
Yeah.
And thank you for the journey that it's been. I know 2020 has been really bad for some people. Thanks. It wasn't bad. It brought you guys to me. That's really sweet. Thank you. So I think we've had this, which has been really important, that we could still be connected despite the crazy lockdowns and despite this virus. And hopefully you guys are equipped now. The biggest vision of all of this was that you guys learn from this and you can share it with your friends and family, that you become equipped to be change agents for those that you love and, your wider community. So this world needs this information now. And our whole vision was to always, for you guys to be more aware, not just for yourself, but for others as well. So on all those little conversations, I know not everyone's like fully on board with some of this stuff, but those small conversations at the family dinners, and you bring up, people are saying, I'm struggling with anxiety. I'm like, have you looked at your gut? Just like those little things are all making a massive change, and that's what we need. So thank you to you guys. Thank you for what you put in to help us, inspire us to create the Gut Brain solution.
Yeah.
And continue doing what you guys do, and we'll love you and see you in 2021.
Awesome. Well, thank you so much, everyone. Great to connect with you all, and happy holidays. We'll see you in 2021.